Good morning, everybody, and thank you all for coming. I want to thank, we'll hear from many of these folks in just a couple of minutes, but want to thank them for all of their work in helping us get to where we are this morning with some great news to share with the people of Columbus. Our fire chief, Kevin O'Connor, our president of IAFF Local 67, Dave Montgomery, our medical director, Dr. David Kessick, our safety director, Ned Pettis, our deputy director, George Speaks, and the great partners we have at City Council and all of our first responders. So welcome to Station 15, the busiest station for emergency medical responses in the city of Columbus. Last year, our hardworking, dedicated paramedics assigned to Medic Transport Vehicle 15 responded to 6,146 calls for service, which equates to an average of 17 emergency responses per day in this neighborhood. Likewise, also housed here is Medic 815, which is a peak demand vehicle and not in service on a full-time basis. But M815 responded to an additional 1,605 emergency calls for service. This combined 7,751 calls for service best illustrates that we must improve and expand our emergency medical services, or EMS, delivery system. Our current EMS system was not designed for the blessed and tremendous growth in population Columbus has experienced over the last 20 years, which combined with an aging population and significant public health challenges have caused a tremendous increase in EMS calls for service. In 1996, the division was composed of 1,269 firefighters who responded to approximately 62,000 EMS calls for service. In 2015, the division had 1,535 firefighters and responded to approximately 133,000 EMS calls. This is a 115% increase in the demand for service, contrasted with a 20% increase in personnel, and illustrates the need to address a growing imbalance between calls for service and resources. We must structurally realign and expand our EMS system for the benefit of our ever-growing city and the evolving public health challenges our first responders confront every day. Likewise, we must structurally realign and improve our EMS system to better utilize our paramedics and assure the highest quality of care for our residents. Today, we announce a significant structural improvement and expansion of our EMS system. Fire Chief O'Connor will provide detail about how this structural change will make us far more efficient by better aligning our resources to an ever-increasing demand. Moreover, he will detail how we will be adding additional training and additional positions for supervision and patient quality care oversight. Dr. David Kessick, the Columbus Division of Fire Medical Director, will explain how this structural change will promote more efficient and effective utilization of paramedic resources and enhance patient quality of care. Lastly, this structural change allows us to expand emergency medical services now and into the future. Investing in our public safety forces is my top priority, including new investments in personnel, apparatus, and fire stations. This priority is evidenced by our proposed 2017 budget of 2 fire classes totaling 80 fire recruits, which is the largest increase the city has had in a number of years. Moreover, we added an additional 25-person recruit class to this year's 2016 budget for a total of 65 fire recruits. These 25 new recruits will begin their training on the 19th of this month. This priority is shown by the rebuilding of Station 2 located downtown on Fulton Street, which will open in the spring of 2017. We will be adding an additional medic vehicle and staffing to that station. Additionally, a ladder truck supporting the far east side of Columbus will become a permanent part of our emergency response force. This priority is demonstrated by funding for the construction of Station 35, located on the east side on Wagoner Road. This will be the first expansion to our existing number of fire stations since Station 34 was built almost 14 years ago in 2003. This priority is underscored by expanding our 5 part-time peak demand medics into full-time emergency medical units staffed 24 hours a day, 7 days a week, 365 days a year. And this priority is exhibited by creating 3 additional supervisory positions that are charged with providing supervision, guidance, and patient quality care oversight. Lastly, I want to thank International Association of Firefighters President Dave Montgomery and the hardworking firefighters that he represents. I especially want to thank our paramedics, Station 15, and throughout the city of Columbus. Paramedics represent approximately 44% of our personnel, but they respond to approximately 85% of our calls for service. This structural change was intended and designed to reduce stress and fatigue and increase morale. We have the best division of fire in America, and it's because of our firefighters and paramedics and the entire team. And we want to make sure that we're taking care of them so they can continue to provide high quality of care to the people of Columbus. Now I want to introduce Chief O'Connor, who will elaborate more on how this structural change, expansion, and investment in our Division of Fire, both in personnel and capital, will enhance and improve our EMS system in the city of Columbus in a deliberate and sustainable manner into the future. Chief O'Connor.
Thank you, Mayor Ginther. Good morning. When I was appointed fire chief, I told then Council President Ginther that one of my priorities would be evaluating the services the division provides and seeing how we can do it better. Since emergency medical service accounts for more than 85% of the total calls for service, I had this at the top of my list. In evaluating the EMS system, one of the things that could not be affected was our focus on patient care. Patient care is and always will be our #1 priority. If there were going to be any changes to this EMS system, the citizens of Columbus had to continue to receive the best patient care this division can provide. I believe this new EMS delivery system does just that. In 1996, the division put into place an all-advanced life support system, EMS, across all neighborhoods. Along with our staffing of 1,269 firefighters at the time, it was designed to handle those 62,000 runs. The ALS system called for 2 paramedics on every EMS transport vehicle and 1 paramedic on every engine company. Today, the same EMS delivery system accounts for more than 133,000 runs, that 120% increase. Further, the city's population has grown from 675,000 residents to over 850,000. However, our staffing has only increased to 1,535. The current system has exceeded its limit and as a result has increased the demand, compassion, fatigue, and stress of our paramedics. In essence, the same number of personnel who were here 20 years ago are doing twice the work today. Today, those 640 paramedics, as we said, provide 85% of the workload at the Columbus Division of Fire. Working with my staff and the leadership of Local 67, we evaluated and designed an EMS system that not only ensures the highest quality of patient care to our citizens, will also be the most efficient. We accomplished this with one goal: put the right resource at the right place at the right time. This new EMS delivery system will allow the division to meet the demand today and expand as our city does. Therefore, the division is restructuring the staffing of our EMS transport vehicles. Right now, every firefighter is trained to the EMT level of certification in the state of Ohio. This new system will have 1 paramedic and 1 EMT on the EMS transport vehicle. Staffing on the engine companies will continue to have at least 1 paramedic at all times. Nothing will change as to the capabilities of either vehicle. Every EMS transport vehicle and every engine remains advanced life support capable. The division realized that having 2 paramedics on the EMS transport vehicles, many times one of these paramedics was being underutilized, having them responsible for non-patient care functions. By removing one of the paramedics off the transport vehicle and replacing it with one EMT, it reduces the high demand on our paramedics currently face. This system will now have 100% of our workforce capable of performing 100% of our work. It gives us the flexibility and sustainability to expand to meet the future. This will be felt immediately upon implementation of this change by the expansion of 5 formerly part-time peak demand units to full-time, 365, 24/7 status in 5 of our busiest neighborhoods. Additionally, we'll be adding 3 EMS supervisors who will provide training and patient care oversight to this new system. Again, patient care is and always has been our highest priority, and this new EMS delivery system does just that and allows us to put the right resource at the right time in the right place so that in the future it's available in the right time in the right place for the next emergency. Dr. Kessick, our Division Medical Director, will explain how these changes can provide more paramedics with more exposures to those complex procedures and will lead to enhanced critical care skills, providing better care to the patients and citizens of Columbus. I want to thank Mayor Ginther, Safety Director Pettis, and City Council for their continued support of the Division of Fire. Thank you.
Good morning, everyone, and thank you, Chief O'Connor, Mayor Ginther. 20 years ago, the decision was made to redesign our EMS system by using the concept that more is better regarding utilization of paramedic resources. It seemed intuitive that the more paramedics that we put out on the street, the more likely that patients would survive, and the better that patient care would be. But when we became capable of examining our EMS delivery model in depth after developing our electronic patient care report and being able to gather data, we found that it was much more complicated than that. The law of diminishing returns came into play, and it became evident that patients did not all require one level of care. We're finding that 67% of our patients only require basic life support, or BLS care, that can be readily provided by a basic emergency medical technician, or EMT. Now, their skill set includes things like managing an airway, delivering oxygen, performing CPR, and delivering a baby, and then many other interventions that are very important. Those 89,212 BLS calls handled last year might include an eye injury, a fracture, back pain, or maybe a psychiatric condition. Almost all of them should have been able to be handled thoroughly and competently by a responding medic unit consisting of 1 paramedic and 1 basic EMT. In medicine, our goal is to provide a patient suffering from illness or injury with the right level of expertise, along with the best combination of testing and therapeutic intervention. Having a neurosurgeon provide care for someone with a splinter in their finger is not practical nor responsible. Within our EMS system here in Columbus, we have a limited amount of personnel resources that must be correctly and efficiently applied based on the patient needs. A recent survey conducted with other EMS systems in large cities all across the country looked at the number of paramedics per 100,000 patient population. Columbus had the highest ratio of 87 paramedics per 100,000. The next closest city was Miami with 60, and most of the cities had much lower ratios and still delivered excellent patient care. A good example of that is Seattle, which had a ratio of 11 and has one of the highest survival rates for cardiac arrest in the country. So, here are some of the benefits that will be realized by this proposed EMS system redesign. First, it will allow experience to be accumulated by the basic EMTs so that when they enter paramedic school, they can hit the ground running and can readily assimilate the educational content. Number 2, with a smaller pool of paramedics, it will allow more of the critical procedures that paramedics must remain proficient in to be available for them to perform. Number three, with the addition of 3 new EMS supervisors who are tasked with quality oversight, it will create another tier of continuous quality improvement to ensure and improve upon the excellence of our EMS care. And finally, it will eliminate that wasted resource of a paramedic serving as a driver and not being able to be used for patient care during the actual transport. The operative question to be asked is not how many paramedics are on the truck, but how many are at the patient's side for the presenting complaint. So even for the patients who have a sprained ankle or an earache and call 911, they will still have the benefit of having a paramedic working with a basic EMT to evaluate and treat their problem. And for the patient with a more serious problem like abdominal pain or an allergic reaction, an engine will be added to that assignment, and they will have at least 2 paramedics and 3 to 4 basic EMTs. And finally, for the patient who has suffered a cardiac arrest or a gunshot wound, they will have at least 3 paramedics and 3 to 4 basic EMTs because an EMS supervisor will be added to that assignment. So, we feel that when someone calls 911, we'll be sending the correct number of EMS professionals. Patient care is and always will be our highest priority so that our citizens will be receiving the correct and the best level of service. The right EMS resource delivered at the right time and in the right place. Thank you.
But to be clear, Dr. Kessick, if you sprain your ankle or have an earache, you should go to the doctor, not call 911.
Right, but we still have those calls and we still respond. So.
Appreciate that. Thank you. And next, we'll hear from IAFF President, Local 67, Dave Montgomery.
Today is a good day for our city because we are both becoming more efficient by structurally aligning our EMS model and because we are making an investment in public safety. I'd like to touch on both of these. First, by restructuring our EMS deployment model, we will have better working conditions for our employees, for our members by creating an equity in the workplace. And second, by investing in public safety, we are investing in the continued success of our neighborhoods and the growth of our city. Increased fire classes, rebuilding of Station 2 and new Station 35, converting our 5 part-time transport vehicles to full-time, and adding additional supervisors for quality control will all lead to better patient care. On behalf of the IFF members, I would like to thank Mayor Ginther, City Council, Safety Director Pettis, and Chief O'Connor for their continued support. Thank you.
And I'm not sure he has any prepared remarks, but we'd be a fool to be in a fire station and not ask our former fire chief and our great new safety director, Ned Pettis, if he'd like to make any comments here this morning. Director? Sorry I put you on the spot. I figure if we're in a fire station, we ought to at least live.
Thank you, Mayor. Just briefly, I'd like to thank Mayor Ginther for his support and express how proud I am of the collaboration between our fire chief and the fire administration, our medical director, and IAFF Local 67 President Dave Montgomery. We wouldn't be here today if it weren't for that collaboration. And I'd like to echo the mayor's sentiments that public safety is the city's highest priority. And for public safety, service to the public is their highest priority. I think it's incumbent upon them to work together to stay abreast of the progress that's made in science, in medicine, and the advancements that occur in public safety. As our medical director indicated, Seattle has the highest survival rate for cardiac arrest in the country. And so it's incumbent upon us to take a look at what communities are doing things the best and see how they will fit here. I am proud of how they have done that, and I am grateful to the mayor for his support in allowing us to pursue the best of the best service for our community. So thank you.
Thank you, Director. We have the best division of fire in the country, and the way you remain the best is continue to be willing to innovate and use innovation technology to deliver high-quality services to the people of Columbus. I'm proud of this collaboration and partnership, and I think it's going to represent the way we're going to approach critical and basic city services for the people of Columbus moving forward. The people of Columbus expect that we will do everything in our power to make sure that we're able to deliver basic city services in neighborhoods throughout this city, and to be constantly reviewing and looking at better ways, more effective and efficient ways of delivering those critical services. Thanks for being here this morning. We'll be around for any one-on-one questions or follow-up. Thanks for being here. Thanks, Chief.